Have you ever wondered what the pituitary gland does and why it's so important? This pea-sized powerhouse, nestled at the base of the brain, is our body's master gland. It governs numerous bodily functions, from growth to metabolism. Despite its small size, when things go wrong with the pituitary, it can have a big impact on our health. So, what happens when a microadenoma or small tumor takes up residence in this crucial gland? Picture this, an uninvited guest causing chaos, disrupting the gland's normal functioning and throwing your body off balance. Unpleasant symptoms may arise from this disruption. Fortunately, there's a way to remove this unwelcome guest. The procedure is called endoscopic transsphenoidal resection of the pituitary microadenoma. Quite a mouthful, right? Here's the lowdown. First, we prep the patient. Then, the surgeon delicately inserts an endoscope through the nose and into the sphenoid sinus. Next, the tiny intruder, our microadenoma, is carefully removed, all while avoiding harm to the surrounding brain tissue. Finally, the patient is transitioned into post-op care. It's a delicate dance of precision and skill. And just like that, the uninvited guest is shown the door. Ready to dive back into the sea of knowledge we've been swimming in today? Today's star swimmer was the pituitary gland. Don't be fooled by its size. This small pea-sized gland located at the base of the brain is a mighty master controller. Think of it as the Hulk in a tutu, small in size but packed with power. It regulates a plethora of essential hormones in our bodies. Any muck-up with our tiny friend can have profound effects, making it the superhero we never knew we had. Our today's gossip was about a particular troublemaker that loves to crash the pituitary party, a microadenoma. These tiny benign tumors might not sound threatening, but they can kick up a hormone storm right inside us. It's like having an unexpected guest at your party who eats all the food, drinks all the drinks, and then decides to dance on the tables. Uninvited and unsettling. Now grab your detective hat, as the symptoms of this party crasher can be as diverse as the genres on Netflix, from fatigue and depression, unexplained weight gain, and even infertility. Despite being less than 10 millimeters, it still can whirl upside down quicker than you can say microadenoma. If you suspect you're dealing with such an uninvited guest, it's crucial to consult a healthcare professional immediately. They are the true detectives when it comes to diagnosing and dealing with pituitary issues. So, how do we bid farewell to this unwelcome guest? Cue the drum roll, folks. It's our knight in shining armor, a procedure known as endoscopic transsphenoidal resection. I know it's a mouthful, but it's just as extraordinary as it sounds. Imagine a tiny knight traveling through the nose, past the sphenoid sinus, and right up to the pituitary gland, to joust this intruding microadenoma. What's amazing about this procedure is that it has a quicker recovery time than it takes for your favorite series to return for a new season. The ingenuity of medical science never fails to amaze, does it? Picture this, folks. In a world where disease and disorders can sometimes feel as overwhelming as assembling an IKEA flat pack, it's incredible to see the lengths we can go to protect ourselves. In our closing act, remember, folks, the pituitary gland, while small, is a giant in its significance. It's the unsung hero of our bodies, playing a crucial role in our overall health and well-being. So, next time you're at a party and the conversation runs dry, just drop in a fact about the mighty pituitary gland and its pesky intruders. That's bound to keep things interesting.